Healthcare effectiveness extends beyond the clinical treatment to include the cultural context that shapes how patients communicate, make decisions, and respond to illness. The Jigger and Davis-Hard 2008 Transcultural Assessment Model identifies essential cultural dimensions such as communication, space, social organization, environmental control, and biological variations and time orientation that guides nurses in providing patient-centered and culturally sensitive care. Transcultural approaches also challenge statistic ethnic stereotypes by emphasizing culture as a dynamic, relational, and continuously evolving. Because today's healthcare environment is increasingly multicultural, nurses must intentionally develop awareness, knowledge, and skills to engage effectively with diverse populations. Professionalism. Three ways this issue affects professional nurses. Number one is it influences on the communication and therapeutic relationship. The culture shapes how patients interpret symptoms, express pain, communicate needs, and make decisions. Grigger and Deverson in 2008 highlight how shared beliefs and customs influence health behaviors and responses to illnesses. An example is a patient from a culture valuing modesty may avoid discussing sensitive health issues unless the nurse builds trust and creates emotional safety. Without cultural competency, communication breakdowns happen, leading to misinterpretation and poor outcomes. The second one is the ethical dilemmas from conflicting values. Nurses frequently encounter value conflicts, situations where patient values, family expectations, and professional ethics collide. These conflicts require careful dialogue and ethical reasoning. An example is an older adult patient prefers to make independent decisions, but their family, coming from a collective culture, expects the decisions to be made by the group. The nurse must navigate the autonomy, the cultural norms, and the family dynamics ethically. Our third is an impact on quality, safety, and clinical decision making. Our cultural competencies directly influence quality of care and patient safety. According to Liu et al. 2022, we found that cultural sensitivity training improves nursing students' diversity, awareness, and engagement, which enhances patient interaction and reduces misunderstandings. An example, misinterpreting cultural dietary practices or medication beliefs may lead to non-adherence. A cultural competent nurse can prevent safety risks by asking open-ended questions and assessing beliefs before implementing a care plan. Opportunities and challenges related to our cultural competencies include miscommunication and understanding due to language or cultural norms, time constraints in clinical environments that limit deeper assessment of our cultural need, and implicit bias that may unconsciously influence how nurses interpret behavior or symptoms. Ethical dilemmas when cultural expectations and conflicts with patients' autonomy of nursing standards. Opportunities to improve this include education and training. Evidence shows that cultural competency education improves communication, engagement, and respect for diversity, according to Liu et al. 2022. Another good practice is cultural humility and practices, encouraging nurses to self-reflect and ask questions and recognize cultural blind spots. Use of interpreters can break down this cultural barrier. This reduces clinical errors and enhances shared decision-making. And then finally, we have integrated cultural assessments, which will help us understand a little bit more about their culture and why they've reacted the way they have. Our role as nurses is to be the interprofessional collaboration This can significantly strengthen cultural competency by allowing nurses, physicians, social workers, chaplains, and the interpreters to share expertise, ensuring cultural sensitivity care planning that addresses the psychosocial, the spiritual, and the family's needs. In turn, this will help prevent errors that may arise from miscommunication due to culture. An example could be a team meeting with social workers and interpreters may help resolve a conflict between a patient's cultural expectations and the medical plan of care, which in turn improves trust and outcomes.